but welcome to our Facebook Live on Q&A about long hauler symptoms with Dr. Putrino from Mount Sinai, who we are thrilled to have. A quick background: my name is Diana Behrens. I'm the founder of Survivor Corps, and as I always say that I started this as a means of mobilizing an army of COVID survivor volunteers to support the sciences in the medical science, medical research, scientific research in any way that we possibly could. What I thought that what meant at the time was donating our years down the line, and that is something that we are, as you all know, we are seeing more and more and more of, especially in our Facebook group. So I don't want to waste any more time because we had so many questions come in from all of you. I want to get to as many of them as possible. But first, Dr. Putrino, could you please introduce yourself and let everyone know a little bit about the work that you're doing at Mount Sinai?
Yep, absolutely. So hi, everyone. It's great to be here. My name's David Putrino. I'm the Director of Rehabilitation Innovation for the Mount Sinai Health System in New York. The role of my center is to take new technologies, anything that we think can really help patients out, and bring that technology to the forefront and really get it into the hands of patients as quickly and as safely as possible. When COVID hit the city and we saw that a lot of people were struggling with symptoms in the home, over a sort of brief, frantic period of about 48 hours, we rapidly developed an app that would allow us to track the symptoms of COVID patients from a home environment on a daily basis. And with a team of amazing health professionals, we were able to monitor people, make sure they were safe. If they were starting to become unsafe, we would escalate them to the appropriate medical care and really just make sure that they're looked after. So we've seen over 1,000 cases of COVID, and we've started to get a real good sort of understanding in our heads of what the symptom course can look like in the majority of cases. And as we start to transition in New York to, we're getting less and less acute cases, but we're starting to see more and more of these long haul cases. We're starting to also develop out services to help people who have been really hit hard by the virus to recover long term. And we have a variety of different services, working with a multidisciplinary team of great doctors and great health professionals through a center that has been similarly rapidly stood up called the Center for Post-COVID Care. And we have as many questions as you all do, so we're really committed to listening. We're really committed to understanding that this is a new illness, and so the patients know what their symptoms are. The doctors don't know what patients' symptoms are. So I think that, if there's one message that I want everyone to hear, it's that you're heard, that you're seen, and that, we really, really believe you.
I think that is actually more important than you can imagine for people to hear, because I think that one of the things that people who are having symptoms who are going on and on and on are, it's maddening enough to not be better. And, it only exacerbates it to have doctors who chalk it up to anxiety, or friends or family who are like, what do you mean? How could you not be better? I thought this was just a form of the flu. Can you start off with giving us a little bit of a definition of what is a long hauler? Like, where do you draw the line between a normal recovery, or, as much as normal can be defined at this point, and where one enters into that next phase of, long-term symptoms?
Yeah, I think that this is a definition that is always evolving. I think initially when we were learning about COVID, people were talking about how there was a 2-week symptom course. I think fairly convincingly at this point that is just not the case. We are seeing far longer symptom courses than that in our cohort of people that we're following. And so, I think that this idea that, hey, you should be all done and dusted by 2 weeks is not the correct statement. So, in terms of people who are really, in the long drawn out fight, we start to pay attention and really focus on people as potential long haulers once they hit the 4-week mark and experiencing very unstable 3 or 4 days, sometimes even feeling perfectly fine, and then boom, something hits them and they have a terrible day. So at about 28 days, we're starting to think maybe we've got, someone who's a bit more of a long hauler here. And I've got to say, it's not the majority of cases, but it's not a small minority. We're looking at about 30 to 40% of people who have symptoms at 28 days.
As we start to look at the number of people, Americans, or people globally who will be infected with this virus by the end of the day, what this could mean for healthcare going forward. I'm going to start off and go through some of the questions sort of categorically, because that's sort of how they come up. And I'm going to because I spend hours and hours a day on the page, I'm going to pick out the ones that I see the most frequently.
Sure.
Here's one on smell and taste. This comes up all the time. I have had complete loss of smell and taste for 15 weeks since testing positive for COVID. Otherwise, all of my symptoms are gone. I've tried prednisone, a steroid nasal spray for months, smell therapy with essential oils, vitamins, and MRI of my sinuses and brain are normal. Is there anything you can suggest? How long will this last?
Yeah. So this is a tough question. It's one of those things that loss of the sense of smell, called anosmia, wasn't initially heavily researched as a symptom of COVID because, people thought, well, there's more pressing things happening. But for a lot of people, smell is just, it's such an important sense. And we've been seeing people who could not care less that they've lost their sense of smell. And we've been seeing people who are absolutely devastated. And so we're trying to understand why exactly COVID causes a loss of sense of smell. The initial literature points us toward this idea that when COVID begins, it causes all of this inflammation in the sinuses, in the mucosa around the nose. What can happen in that initial sort of period of inflammation is that some of the nerves that come off the olfactory nerve, which is the nerve that allows you to smell things, can actually get damaged or even sort of completely destroyed in the inflammatory process. Now, peripheral nerves grow back, but they grow back extremely slowly. So we're talking about, sorry to go all metric on you guys, but we're talking about 6 millimeters per week, which is a tiny amount. I don't actually know what it is in inches, but it's like 1/16 of an inch per week in terms of coming back. And so many people may unfortunately be looking at many months of recovery of their sense of smell. We hope that this is...
Are there things that people can do to assist that process, that nerve recovery process?
Absolutely. Although this person who wrote in was talking about smell therapy with essential oils perhaps not being so effective, I would say persist with that. So things like prednisone are designed to take away the inflammation, and hopefully at this point the inflammation has resolved, and now we just need the peripheral nerves to slowly grow back. So I would say as they're growing back, the more you can do with just stimulating your sense of smell, so doing things like exposing yourself to novel and different smells. There's this great website on the internet called smelltracker.org that was developed by an amazing smelltracker.org. Yeah, it's a lab that I've been aware of for quite some time, of some really great olfaction researchers, and they created this home kit for how you can test your smell at home. And it allows you to, because, you know, your sense of smell is one of those things of like, it can be very cognitively, like, did I actually smell that or didn't I? So this allows you to sort of day by day track, you know, what you're sensing and sort of give you an idea of what's going back. Anyone who's in New York City, we have a couple of our ENT specialists who are working at Mount Sinai who are studying this actively, so you can enroll in clinical trials. One of the clinical trials that they're exploring is actually the use of fish oil as an intervention for the loss of smell. So that could be interesting. It's based off of... pardon me?
I was just joking. I said you can try fish oil at home.
yeah, well, you know... True, and no guarantees that it will work, but it's something that they're looking into.
One thing, just as a last note on the smell and taste, one thing that I've seen, it's not in the question here, but I see a lot on the board, is people complaining that they smell the smell of cigarette smoke, like old, stale cigarette smoke, despite there being no smokers in the household or anywhere nearby. That's a very common olfactory symptom, it seems, for that crowd. I don't know if you have anything, if you've heard the same or not.
Yeah, totally agree. We have been, yes, similar. So we get an array of chemical smells. Yes. So I'm smelling bleach. I'm smelling, and obviously that's not. And it is something that we've been noticing. What that nerves that cause that allow you to smell to be damaged by the inflammation, some of the signaling that they're providing to the brain starts to get distorted, and so you start to get these smell profiles that aren't actually correct to your environment. And so often people will start to have this distorted sense of smell, and then they'll completely lose their sense of smell. And then as they're returning, they have a distorted sense of something that we've been seeing a lot of.
Interesting. Okay. Moving on to the next topic that probably gets the most amount of play on the board of everything is shortness of breath and oxygen levels. So I'm going to read you 4 questions in a row right here, all sort of on the same topic, and then you can address them as a group. What can you suggest for people who are still getting shortness of breath after many, many weeks? Why do our heart rates keep staying high even when resting, even after having a negative COVID-19 test? My oxygen levels dip for no reason in the late afternoons, and I get very fatigued. What tests should be done to determine if my lungs are damaged and to what extent? I have had lingering breathing issues, and my doctor diagnosed me with asthma. Do you think a Nucala, sorry, I'm not a doctor, Nucala, I'm not sure how to pronounce that, shot would be helpful, or should I have my heart examined?
Gotcha. So, all great questions, all very common as well. So I'm going to start off really high level and really simply by saying the initial response to all of these is that we need heart health cleared and lung health cleared. So go and see a cardiologist, go and get an EKG, make sure that there's no serious heart pathology, because COVID has been associated with some serious heart pathology. So if you're starting to experience a racing heart, shortness of breath, things of this nature, swelling in the extremities, and you haven't had a cardiologist clear you, make sure that happens, because it is unlikely that it is a heart or a serious lung problem, but these are the things that we want to clear first before we go further. Now, we know that COVID is really hard on the lungs, and so shortness of breath and fluctuating oxygen levels are to be expected. And once you have sort of seen a pulmonologist and seen a cardiologist and cleared serious pathology, the next thing that kind of makes sense to happen is to engage in pulmonary rehabilitation. Because in many cases post-COVID, even if you thought that you had, mild to moderate COVID, there's a lot of, the lungs take it really hard, and so there's a significant amount of decommission, even if you're previously fit, that has been associated. So
I found that out the hard way.
Yeah. And so we have pulmonary rehabilitation, which is a sort of, graded rehabilitation of cardiovascular exercise that is strongly linked to blood oxygen levels using things like a pulse oximeter that allow you to slowly build your reserve back up and get moving. I think that, again, the thing that people need to keep hearing because of all of the other noise out there is that this is not the flu. This is something that COVID is something that really seriously affects the lungs. We saw that a recent study showing that even in people who were asymptomatic, 54% of asymptomatic cases showed some level of lung damage on an MRI and CT scan. So even when you're not showing symptoms, this is affecting your lungs, in a way that may cause you to feel long-term issues with fitness and shortness of breath and so on. And it will take a little while to continue to recover from that, but pulmonary rehabilitation is a really good, a good.
Can you repeat the type of breathing rehabilitation? What is it called?
Oh yes, sorry, my accent. Pulmonary. So
pulmonary rehabilitation. So
pulmonary.
Are there particular exercises that people can do at home to rehabilitate their lung capacity?
So what we are doing at Mount Sinai, I'll talk about that through the Center for Post-COVID Care, is that we're providing telerehabilitation for patients. So what we do is we send them out a pulse oximeter, and we get on Zoom or one of our other HIPAA-compliant video chat services, and we take them through exercise programs in the home. With pulmonary rehabilitation, I really want to
I think
stress that it's something that I want closely monitored by a healthcare professional. Typically, we do it in person because it's something that you want to monitor closely. But hello? Diana, can you hear me?
Yeah, now I can. It broke up for a little bit, but I hear you now.
Okay, great. Where did you lose me?
I followed along. That you probably walk people through the pulmonary exercises. I was asking if there was any that people could do on their own who might not have access to Mount Sinai's telemedicine program.
Yeah, so what I would recommend on that phrology are cleared, and their primary care practitioner clears them for exercise. Then gentle exercise with a buddy at the level where they can comfortably maintain a conversation while they're exercising is a good way of slowly building up their reserve.
Great. That's super helpful. Next question is on autoimmune reactions. A physician has suggested to me that what I'm experiencing is an autoimmune reaction to COVID-19. My doctor recommended an anti-inflammatory diet and supplements like iron, vitamin B, and vitamin D. What is your opinion on this suggestion that it's an autoimmune overreaction and attacking organs like thyroid, kidneys, liver, heart, etc.? And we are also seeing a lot of reports of like inflammatory joint issues, arthritic type, Lyme disease type of autoimmune reaction, similar like to brain fog, those sorts of symptoms. So, what are your thoughts on the autoimmune piece of this, or do you think that there is one?
Yeah, so I think that this is a reasonable approach, and I think that it's first of all, let me commend the doctor for listening, thinking about a theory, and looking to intervene on a theory. We are certainly seeing many long haulers start to develop a new cluster of symptoms. And so I think that in the coming months, long haulers are going to hear a lot of things being thrown at them. They're going to hear autoimmune disorders. They're going to hear dysautonomia. They're going to hear POTS. They're going to hear...
You say that
dysautonomia. Yes, which is a disorder of the autonomic nervous system. They're going to hear chronic fatigue syndrome, fibromyalgia. The reality is it is too early to know what is happening, but we do know that in a certain subset of COVID survivors, this new cluster of symptoms are appearing, and we don't quite know how to classify them just yet. Speaking about a autoimmune problem, I think is a reasonable theory, because we know that COVID creates a very, very strong immune response throughout the entire body. And so long as you adhere to the therapy, take lots of notes, log your symptoms, go back to the doctor and say, here are the things that made me better, here are the things that made me worse. What's the next theory? I think in this particular case, what's important is that everyone be patient, everyone find a doctor that they can actually converse with on a level where it's clear that the doctor is hearing them and listening to their symptoms and making a good faith effort to help. And then from there, I think it really is, working together as a team to try and solve this riddle.
Yeah, no, I mean, and riddle it is. There will be so much to learn. I mean, it'll be interesting if we were to have this conversation again in 6 months to
Absolutely.
see the differences in what is known. Here's one on feet, toes, and extremities. My feet and toes ache and are fatigued easily and tingling. How and why does COVID cause pain in the feet? It's worse at night. Can you recommend any medications, pain relief, or nerve pain? Tests, blood thinners, or anticoagulants? What causes the tingling in arms and legs?
Yeah, so this is another one that we've been seeing very commonly. This particularly is a symptom that has made a lot of the, my response to the last question, there's lots of diagnoses that are flying around. A lot of people who are team dysautonomia, this is a dysautonomia symptom. This is classic, tingling and numbness in the extremities, worse at certain times of day.
Yes.
And so this is one of those ones that looks a lot like dysautonomia. Dysautonomia can be treated. There are a number of different therapies, both exercise-based and non-exercise-based for it. And my recommendation here would be to try to find a physician who is a dysautonomia specialist. Typically, they tend to be cardiologists. Once again, I'm going to throw out that warning, because you can Google dysautonomia and see that a good amount of cases are treated with exercise. make sure you are cleared for exercise before you get into an exercise therapy, because in a lot of cases you can have really serious adverse.
Experiencing what we experienced in April. And so here, the questions about disbelief, and I know we touched on it, but I'm curious to hear really sort of some of your practical thoughts on this. I've been sick for 100+ days, but no one believes me. I've tested negative for COVID-19 and negative for antibodies, but I'm having terrible symptoms and have been sick for months. What am I supposed to do? My doctor thinks I'm making it up.
Yeah.
And I think that you could swap in tested positive or negative for COVID in there, and the question would remain the same.
Absolutely. The testing thing, I saw that there were some questions about testing, so I'm sure we'll get right deep into that at some point.
We'll get there.
Totally agree. Give me any configuration of testing and I can explain some sort of wild theory as to how it got there. So I don't think that that's an issue there. I think disbelief is a huge issue with a lot of doctors who have not seen much COVID and don't understand how very varied the symptoms can be. I wish I had a better piece of advice other than this group. You guys are doing such an amazing job, and there are so many other groups as well in terms of advocacy. There is this, wave of news stories and new resources and information that is coming out because of advocacy groups. So I would say keep advocating to be heard and to be believed. One of the things that we're doing at Mount Sinai is we are rapidly sharing as quickly as possible with as many physicians around the country and around the world as we can. We were speaking with the World Health Organization in a working group this morning at 7 a.m. about long haulers and how we need to take this seriously. We were speaking to the American College of Physicians on Wednesday night about long haulers and how they need to be taken seriously. We're really working to get the word out. We're really also trying to be committed to being a resource that physicians can contact if they have questions. And I think that the short answer here is advocacy works, making noise works, and we've just got to, keep persisting. And personally, I'm just so sorry for everybody who is going through this sort of cycle of disbelief right now. And I hope that they know that they're not alone. And I hope that they know that, it's a shared experience and we're working to make it better.
That's reassuring to hear. Okay. What does it mean if I test positive for the virus, then weeks later test negative, and then weeks after that test positive again? Have I been reinfected? And then there's, I'm going to ask this along the same one. You can answer them both together. Is it possible that some of the long haulers are testing negative for COVID-19 because the virus is no longer present in the nasal passages, where most tests are done using swabs and is instead lingering in blood vessels and or other organs? Would it make more sense to conduct blood tests on probable cases that are testing negative using traditional nasal swab tests?
Okay, so a couple of things to unpack here with the testing. So I'll address the first question first, and I'll start by saying across the board, the tests are imperfect, and it's estimated that there is a false negative rate of around 20 to 30% of the tests. What that means is, if you test positive, highly accurate and most likely that you're COVID positive. If you test negative, there is the 20 to 30% chance that that is not correct and you're actually positive. And we really need to sort of get that out there, because I don't think that that is well enough known. So then when we think about the first question, there are lots of reasons why someone can test positive, then test negative, then test positive again. Let's start with the most likely. The most likely, statistically speaking, is that you were COVID positive, you then had a false negative, and then you got tested again, you're still infected with the virus, and you're COVID positive still. The much less likely explanation is, yes, you were COVID positive, you recovered, and then you were reinfected. The reason that's unlikely is because we know that the virus mutates very slowly, and to be reinfected by the same virus, it has to have mutated and you catch a separate strain of the virus. Thankfully, what we've learned about this virus so far is that is only happening in a small amount of cases. It has happened, but it's very rare.
So there have actually been cases of reinfection, of actual
there have been cases. Yes.
In the United States, or
all over, to my knowledge so far, and that is, I'll say limited. I've only heard of, less than 5 cases in the United States of a reinfection, which really goes to show how rare it is. But there have been confirmed reinfection cases. But we're really fortunate that the virus, it's not known that the virus mutates slowly, and therefore reinfection is extremely rare. So then, to address the other question, again, the first thing that I would say is, as you test negative for COVID-19, a negative test is just not a guarantee that you're not infected. The other thing that I want to do is make sure that we differentiate between the two, the two clusters of long haulers, the people who are experiencing lingering COVID symptoms versus the people who are starting to experience a new cluster of post-viral symptoms, which could be actually happening as a result of the body's response to the trauma that it suffered. So those are two distinct things. And so what is possible is you can recover from COVID and then go into this post-viral syndrome. You don't have COVID anymore, so you will test negative, and you'll test negative multiple times, but now you have a syndrome as a result of your body having a strong response to the trauma that it's just been through.
Interesting. So if you were to advise a patient who had an average case, recovered, nothing really remarkable. Let's take me, for example. I had a very average case. I recovered. It took longer than I thought it would, but I ultimately recovered, completely. I probably need a new eyeglasses prescription, which is a question that I will get to in a second. But I went to my GP last week and I said, well, I want a full blood panel. And all of a sudden I saw that my iron was low and my vitamin D was low, and, there were other things. What should the average person who is not a long hauler but still wants to be sure, that's why I can't stay up past 9:45 at night anymore, because my iron is so low, which I've never had before in my life. It's hard to know, Same way that people wonder, is this COVID or is this seasonal allergies? It can be hard to know, well, have I been staring at a screen too long? Or has my vision actually gotten worse? So what are the tests that you would recommend that people have as sort of a routine post-COVID checkup to see sort of, I'm feeling okay, basically. I don't have any major concerns, but, let's just do a routine check. What do you recommend requesting?
Yeah, so I am going to apologize here because I'm going to give a bit of a cop-out answer on the grounds of I don't want anyone to think that I'm sort of recommending tests because that can get hairy. So I would say this is an opportunity to have a good conversation with your primary care practitioner to talk about, the fact that COVID is debilitating. It does last a long time. It does decondition people. And many of the tests that we have, so I think that what you did was a really reasonable thing. You went to the doctor, you said, look, can we just do a full blood panel and see if everything's looking okay? I think that is, in the absence of targeted direct symptoms, I think that is a really reasonable thing to do.
I did the same for my children as well.
Pardon me?
I did the same for both of my children as well, and one showed up with low vitamin D, another with low thyroid, which had never been picked up on before.
Yeah, and I think that is a really reasonable thing to do. I think that in terms of being heard by a primary care practitioner, it is an unreasonable thing for a primary care practitioner to refuse. And I also think in terms of self-advocacy, a really good tip, a practical tip is if you're asking for something such as this, if you're just like, look, I more or less feel fine, but I'm not quite feeling myself. Can we just do a full blood panel to make sure that everything's okay? If you're refused, if your doctor's like, listen, you're fine, go away kind of thing, and it's dismissed, requesting that they document their refusal to adhere to your request is a really good way of making them sort of
good note, everybody.
Pause and think maybe.
Wrote that one down. That was a good doctor's tip. Listen to that one. Say it again. That's a good one.
Asking your doctor to document that they have declined to run the simple test that you have asked for. Now, obviously, this is not the case with more fancy tests that require specialized equipment and resources. But
we're talking about a blood panel work.
A blood panel. Come on, that's a reasonable request, especially if you're feeling off and you don't feel like how you were pre-COVID. And it's a very simple, polite, unemotional way of getting their interest and making them think, hey, maybe I should actually just do this test.
So one of the questions, I'll read you the question, then I'll give you sort of a little bit of a follow-up too. One of the questions raised over and over again in our forum is, at what point can you safely say that you are not contagious? This is not a specific long hauler question, but applicable to many, many of us. If you are mostly better, no fever, no cough, etc., but have lingering loss of smell, for example, or brain fog, or shortness of breath, or tingling sensations in your arms or legs, are you still contagious? Is it safe to go outside if you have quarantined for at least 2 weeks but still have lingering symptoms? And I would add, as the addendum to that, is requirements for donating convalescent plasma is that you be symptom-free for 14 days, with the obvious challenge that symptom is an undefined term. So how would you address sort of lingering symptoms, not necessarily long haul type symptoms, but lingering past the 14 days in terms of contagion and in terms of ability to donate?
Mm-hmm. This is a great question. It is a rapidly changing question. So I think I really like the way that we got to donating convalescent plasma, because I think that is a really good guide for what are the most conservative people saying, right? In fact, depending on the convalescent plasma study, they say either 2 weeks or 3 weeks of being completely free of symptoms. The only symptom that they leave out of that is anosmia. So loss of the sense of smell is okay. You can have loss of sense of smell, but if you have no other symptoms, you're okay to donate plasma. So that is as conservative as it gets. That is them saying, we're pretty sure if you fit that profile, there is no way that your plasma can infect somebody else, and that everything that is going on is going to be fine. So if we take that and work backwards, what we're really saying is, with our current base of knowledge, anything beyond that, there's a small chance that you can infect others if you have tested positive and you still don't fit the convalescent plasma criteria. So at that point, I think that making sure that at all other points you're wearing a mask, you're engaging in good hygiene, you're doing all the things that you should be doing to that the CDC are telling people to do, maintain social distance and good hygiene and so on and so forth. These still all apply if you're still showing some symptoms, because since you stop shedding virus that will infect somebody else. And so I think that at this point we've got to be as conservative as possible and say, really, until you're no longer showing any symptoms for a period of 2 or 3 weeks is when you can safely say you're probably not going to infect anybody else. Up until then, be as responsible and as safe as you can.
So we really don't know at the end of the day how long we are shedding those virus particles for?
That's correct. I mean, early in the game, there was one number, and then a bunch of other studies were like, no. People 3 weeks, 4 weeks down the track are still shedding virus, and that's why I think that not focusing on days and focusing more on symptom presentation seems to be a really nice way of being safe.
One thing that's coming up a lot is hair loss. I've recovered, but I am now losing my hair. What can I do? How long does it last?
Yeah, I don't have a good answer for this one. I haven't come across it myself. I'm going to look into that, and I might email you guys back on a response for that.
That'd be great. That's come up quite a bit. Another one, I'll give you this as just a quick personal note that where I found actually great comfort in our own group. But I woke up 6 or 7 weeks after initial onset of symptoms. I was completely better, but I had what seemed like a sty, but in the middle of my eyelid, but like almost like a blister. Like it was I could hardly open my eye. It was very, very painful. But it wasn't like on the lid. The red part. It was like really, in the middle of the eyelid. And I did a telemedicine appointment with my doctor, who prescribed me some sty medicine, which might or might not have helped. It slowly went down over a couple of weeks. I ended up with a black eye for a day or so, where it had drained, accumulated underneath, and that was that. And I didn't really think more about it until about a week after that it was resolved. And I see people start to post online Has anyone experienced 6 to 7 weeks after the initial onset of symptoms this exact same thing on the eye, like this bump, which eventually drained? And I would have had no idea that that was COVID related had I not been on Survivor Corps and seen other people complaining about the same thing, much like the hair loss, that if you're not in a community who's talking about it and seeing other people report the same thing, you might just think like, oh, there you go. That's what happens. Like, some months you lose more hair than others, and not necessarily making the connections, which is why people sharing their symptoms and their stories on Survivor Corps is so powerful and so helpful to one another and to the medical community as well. So the next one is on heart. I'm experiencing tightness that starts mid-arm up to shoulder, under armpit, and across the front of my upper chest. Have you heard of these type symptoms and any suggestions for tests to do or treatments?
Mm-hmm. So, number one, cardiologist, of course. So you're going to hear me talk about heart stuff a lot.
Go to your doctor. The internet's wonderful. Go to your doctor.
Exactly. So, have them run all of the tests that they need to run. Endocarditis, pericarditis, myocarditis are things that are happening with COVID, and we need good cardiologists to make sure that patients are getting seen to rule these things out. Once you get a clean bill of health on your heart, the next thing to explore here is certainly pain of a spinal origin. One of the things that is happening a lot with COVID, and we are seeing a lot, is that people are sitting in one posture. Even people who aren't getting a COVID infection are working from home. They're schooling from home. They're doing everything from home in front of a screen. Lots of immobility, and what can happen is there are joints in your thoracic spine. They're called Facet Joints. These are the joints that connect one level of your spine to the next level of your spine. When you sit in one position for a very long time, they get really stiff and really sore, and they refer pain around the rib cage, under the arm, to the front of the chest. Sometimes you don't get any pain in your spine at all, and you're getting this burning pain in your chest. And I can't tell you how many times we've actually seen people pre-COVID present to the emergency room with these symptoms, thinking they're having a heart attack, when one physical therapy appointment fixes their pain. So once the heart is cleared, I would recommend a physical therapy appointment to focus on stretches and mobilizations of the thoracic to see if that helps to relieve the symptoms.
That's great advice. And again, just to reiterate the first part, go see your cardiologist first. Have you heard of any suddenly developed severe food allergies post-COVID? Has that come up at all for you?
Yes, we have been seeing food sensitivities and food allergies.
Like what? Tell me more.
So, just like not enjoyable things. People suddenly being like, I can't have dairy anymore, or God help us all, I can't have gluten anymore, and other
stuff. Are sugar sensitive in the diabetic correlation? We've been seeing
issues with sugar. We've been seeing issues with, believe it or not, one of the interesting ones we saw was nightshade vegetables. So these are things like tomatoes, eggplants, peppers, potatoes, plantains. Many of these foods are high inflammation foods.
All the things that you would avoid in an anti-inflammatory diet.
Bingo. Yep. So I don't think that's a coincidence. I think that we know that again, COVID COVID causes this rush of inflammatory chemicals into your body, and so all of a sudden you're very, very sensitized to a lot of different things, and so foods that cause increase in inflammatory markers that are known to do that will make your symptoms worse, and that can be a food sensitivity. In other cases, foods that you may have had a mild allergy to will similarly become less than a mild, allergic reaction. They'll become much more pronounced. So, again, it's because COVID is causing this, very intense systemic response. We're seeing a lot of these things surface. It's nothing to be, very alarmed about. It's common, and it may be that these foods need to be avoided for a really long time, unfortunately, until all the symptoms come under control. But it's certainly something that we've been hearing about.
That's super interesting. So the next question comes right on the heels of that. Of can you recommend GI-friendly foods that will help with daily eating and are gentle on our bodies? And what I imagine is meant by that is partially this sort of anti-inflammatory piece, and then also, I had horrible nausea. I lost 12 pounds in 2 weeks when I had COVID. Not to worry, I put it all back on. And just to go back to the anti-inflammatory, I will put in a plug for my favorite anti-inflammatory diet, which is the Whole30, which you don't have to pay anything. It's just basically very common sense. But it's taking out a lot of those foods that you mentioned before. So just going back to the question, can you recommend foods that will help both from an inflammatory perspective, and also for those who are going through that horrible nausea where they just are having trouble, keeping weight on? People lost a huge amount of weight through this.
Yep. So this is a really tough topic because food is just so individualized in so many ways. And so there are general principles, of course, that seem to make sense in what we're seeing right now, which is avoid, high inflammation things. And you'll see things on the internet like the low FODMAP diet and things like that. And one of the things that I would advocate for for two reasons is intuitive eating and mindful eating. So rather than trying to, sort of crash diet on different things, absolutely always, regardless of whether we're in a crisis or not, I'm going to advocate strongly for whole foods, like trying to eat healthy, eat well, and do all of those good things. But I think that we need to face a few facts. One of those things is that that's not always the cheapest or the easiest thing to do. That's not always available. That's not, even right now going to the grocery store is a saga. So I think what we need to focus on is really being very mindful of food that you take in and how it is affecting you in the moment. So run little experiments with yourself. If you think that there is a link to eating a meal and feeling symptoms, start to experiment. Start to eliminate certain things. See if you still have a reaction. Bring those things back in, and document everything so that you can be really methodical about what's going on. There's a couple of be a bit of a scientist, exactly, and also play around with quantity of food, because sometimes big meals will cause your autonomic nervous system to get really upset, and so all of these symptoms that we're seeing in the long haulers, like dizziness and mental fog and extreme fatigue, will come about because you took a really big meal on board and your nervous system just, gave out. So making evidence that you're eating it. Just really be the scientist, be the scribe, document everything, keep a symptom check. Everything okay?
I'm losing you. Are you there? Are you back again?
No. Can you hear me? I can hear you. Yep.
Yeah, now I can hear you. Okay. I'm going to ask you sort of just two quick questions, and then I just want to finish up, with a sort of general question about your observations from what you've seen at your work at Mount Sinai so far with it. So we can go one, and the answer might be a quick no, but have you seen any effects on women's menstrual cycles? It might be too early to report on issues about fertility, but anything that women should be aware of?
Definitely. I think that in terms of women's health, being really unwell for a really long period of time, sudden crashes in body weight and fluctuations in body weight are going to cause the menstrual cycle to become irregular, missing periods. These things are going to happen as your physiology is hit by the virus. Once again, I'm going to advocate for lots of tracking. There are great apps out there like Flow, FLO is one of those on the internet that I've seen that a lot of people really trust for monitoring their cycle. And
I've been a long time fan of Clue, and I also use the one on my Fitbit. But
there you go.
I'm a big data tracker.
And I think it's a really good idea because the reason why is these should return to normal as your body physiology kind of rights itself. But if it doesn't, then you've got 2 months of data that you can go to an OBGYN and say, look, this is what has happened and what should we do about it? Long-term stress of being unwell, the sort of physiological disruption that happens with this virus, it's going to change what normal hormonal function is. And as you alluded to, we don't know how that might interfere with fertility in the long run, but there's probably going to be some effects as, again, our sort of hormones start to right themselves as physiology comes back to normal. And so the best thing that we can do and the best indicator you have of that is the menstrual cycle. And so tracking it closely with an app or with a wearable is going to be a really good collection of data that can be used to assist moving forward.
I can't miss this opportunity to put in a plug for one of my favorite studies out there, which is the Stanford Wearable Fitness Tracker study, which if you're not signed up for already, I highly recommend that you go to survivorcore.com and sign up for it. I was fascinated when I learned about their study, and I looked at my own data, and I've been wearing a Fitbit pretty much every day since 2013, I believe. And if you look at my heart rate in March, it's just an absolute peak. And it took, I'd say, 90 days to come back down to I have a naturally low resting heart rate, but to come down to my baseline. So it took 90 days, well past the point of my recovery. And very interesting to see my weight dip down during that same time. It was, everything about it was sort of fascinating to see. And I know some of the trackers also measure skin temperature, which they think will be able to. The purpose of these tracker studies is that they think that they can predict the onset of the virus before the onset of symptoms through these wearable devices. The last question I'm going to ask you with has sort of as a specific answer is many people ask how it's possible how they feel better and feel back to normal for several weeks and then suddenly wake up with symptoms again. What can you advise? What are the signs for long haulers to go back to the doctor or to the ER?
Yeah. Again, the irregular and unsteady symptom course of COVID has been something we've been scratching our head about. It really does feel like 2 steps forward, 1 step back all the time.
That's how it feels like having it. That's how I kept on describing it when I was sick.
When we plot our data, and we just sort of look at symptom presentation over time, in most conditions you'll see, symptom presentation over time, the symptoms just sort of like taper off and you get better. In COVID, it looks like this jagged sort of, bandsaw that takes a really long time for the symptoms to go down. And then you'll see these long stretches of no symptoms, and then boom, the symptoms are back and away they go. I mean, what this indicates to me is that we're dealing with a virus that our immune system is struggling with and is having a hard time completely getting over, which is why it'll be sort of like low level, and then something will happen and all of a sudden you'll get more symptoms and away you go. It's probably worth mentioning that it can also be that your body is so deconditioned and so exhausted from fighting COVID that you go straight into another illness. So you finish with COVID, you have a couple of weeks of being okay, and then you catch the flu. That is also a possibility because you're so deconditioned and your immune system is sort of knocked out. It's kind of how a lot of people have also noted that they get cold sores after COVID.
And thrush,
it's because
it's a very common thrush is a very common complaint also.
Exactly. It's because their immune system is so weak after fighting the virus that all of these sort of latent viruses in their system sort of come up and say, "Hey, remember us?" And then you sort of like into your next fight. So there's lots of things that could be going on. As always, the things that we want to look out for is extreme shortness of breath. I mean, if you're getting to the point where you cannot complete sentences because you're so short of breath, and you haven't been exercising or doing anything, get to the doctor. If you're feeling irregular heartbeats and things like that, get to the doctor. If you're noticing that you're going blue around your lips and your fingertips, get yourself to the doctor. Extremely high fevers, like over 104. So all of the things that you would ordinarily go to the emergency room for, get to the emergency room for. But with milder symptoms, my recommendation would be just, be aware that things that if this are particularly mild, it's probably just the virus, popping its head back up, and just do your best to manage it, stay calm, rest, and wait for it to pass.
Well, thank you very much. I am blown away, but in an hour and 2 minutes, we managed to get through every single one of the questions in my sheet, which didn't come close to all the questions that were asked by our members. But I just wanted to ask if you had any last minute, final thoughts for our group who are struggling with these issues of, what are sort of the most interesting, impressive things that you have learned and seen and learned through your experience at Mount Sinai that would be of use to our community?
I think that really what I want to keep putting out there is how grateful I am for groups such as this. The idea that there are these support groups that are self-organizing to help educate the medical community. You know, the one thing that I really want to leave everyone with is when a new disease emerges, the textbooks are useless. What we need to do is come together as a community. There needs to be two-way communication. There needs to be genuine respect in both directions. And, you know, I really hope that we can work together with advocacy and with education to get to a point where there aren't doctors out there denying people's lived experiences and stopping to listen and say, oh, okay, well, we don't know much about this illness, so I'm going to listen. I'm going to address the symptoms you're telling me that you're having, and we're going to work together until we find a solution. And really, you know, that's where I want to end it. It's two-way communication. I really want to stay in touch with this group. I really want to have more communication sessions. I want the group to learn to meet my team, who are also, like, you know, actually way more impressive than I am. So have conversations.
We would love to do that, and we have questions for days. So
awesome. So do we.
It's absolutely a two-way street. And for all these Survivor Corps family members out there, please also continue to ask your questions online and fill up that Facebook group with your symptoms, with your questions, with your comments. All of that data it's all extremely important. You know, all those polls, fill them out. You know, tell us what your blood type is, or whoever it is who asked. It's usually not us asking; it's someone else who's put out the question. But we are breaking ground here, and the more we can work hand in hand with the medical community, we can help them heal us. So thank you, Dr. Putrino. Thank you so much for your time, for your dedication to COVID survivors, towards battling this disease, for all of the work that you do, and for sharing it with us at Survivor Corps.
Of course. Thank you for having me.
Thank you.